Peplau's theory of nursing was that she believed that the nurse-patient relationship is the center of nursing, and her primary concern was how, as a nurse and patient, how they can actually relate to one another. Her theory was designed to ensure that patients received the best care possible, and that with this bond, they would help speed along treatment and their recovery. She described 4 phases in her nurse-patient relationship. Phase 1 being orientation, to where a health problem has emerged that results in a felt need to where nursing and healthcare treatment is sought out. In 1997, Peplau combined the phase of identification and exploitation, which resulted in there being only 3 phases: orientation, working, and resolution. So with phase 2 and 3, identification and exploitation being turned into working, in this phase, the patient identifies those who can help, and the nurse explores the feelings of the patient. During this phase, the patient feels like an integral part of the environment, and the nurse must be entirely aware of the various phases of communication, since the patient's independence is likely to fluctuate. During this phase, the nurse can begin to focus the patient on the achievement and end goal. And in the resolution phase, also termed as termination, this is the time where the patient starts to adopt new goals and begins to work on themselves without the help and overall assistance of the nurse. Meta-paradigm concept as defined in Peplau's theory. Person being the patient or the person with said problem. Environment being forces outside of the patient themselves. Health. To Peplau, this implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. Peplau explains that nursing is therapeutic because it is a healing art, assisting a patient who is sick or in need of health care. It is also an interpersonal process because of the interaction between 2 or more individuals who have a said common goal, and nursing, the therapeutic process between the nurse and the patient. Hildegard describes 6 nursing roles that emerge during the nurse-patient relationship: role of the stranger, role of the resource person, teaching, leadership, surrogate, and the counseling role. These were all later refined to include teacher, resource, meaning the nurse provides information to help the patient better understand the problem at hand, counselor, leader, where the nurse initiates and maintains group goals through interaction, which to me basically defines the nurse and the doctor relationship, technical expert, where the nurse provides physical care and clinical skills and uses basic nursing judgment, and then lastly, as a surrogate, where the nurse may fill the void of another. Seeing how Peplau described nurses and all the roles that we may have, it literally seems like nurses are the jack of all trades. Nightingale's environmental theory. Florence Nightingale, being the founder of nursing, had a theory that focused primarily on the patient and the environment, with the nurse manipulating this environment to enhance patient recovery. She had 13 canons on which her philosophy was centered, and they are listed below. Manipulating or protecting a patient's environment for recovery based on his or her condition or disease is still very much practiced today. An example being when patients are suffering from tetanus or brain injuries who need minimal noise to keep them calm and prevent seizures. Nightingale also believed that nursing was a calling and that the recipients of such nursing care were holistic individuals with a spiritual dimension. Thus, the nurse was expected to care for the spiritual needs of the patients in distress. Peplau was considered a pioneer in the area of theory development in nursing and was one of the first to present a nursing theory since Nightingale. Prior to her work, nursing involved acting on, to, or for the patient, making it seem as if the patient was just an object of nursing care versus being the primary focus. Peplau's work was the force behind the conceptualization of the patient as a partner in the nursing process. Peplau and Nightingale's theories have multiple differences. The primary focus in Peplau's theory is the patient and the nurse and the relationship that they build, while the primary focus in Nightingale's theory is the recipient of nursing care being the patient. These 2 theories are both the same in that they both focus on the environment and what is required to actually enhance it to make it better for the patient. In Peplau's theory, the patient feels like an integral part of the helping environment and they make minor requests or changes to help improve it. In Nightingale's theory, she focuses on the external and internal changes required for better nursing care. This can be as simple as things like food and water and comfort within the environment. Nightingale's theory to me focuses a little more on the actual external aspect of nursing care. In Peplau's theory, the primary overall health focus is on personality, ongoing human interaction, and processes in forward-moving growth. Basically, moving towards the end result of improvement. Whereas Nightingale's theory, she quoted, "Not only to be well, but to be able to use well every power we have to use." To me, I understand this as not only internal health, but also external overall well-being is important to her. They both differ in their primary overall nursing focus, where Peplau has the primary nursing focus of the therapeutic interactive process between the nurse and the patient, so this being the patient-nurse relationship, whereas Nightingale's primary focus was to alter or manage the environment to implement overall health. Both of these theories, I believe, if combined, make the perfect nursing theory and care required to care for all patients, not only physically, but also emotionally. The schematic model for Peplau's theory of nursing, I chose the solar system. The patient is the primary focus of all care, being the sun, and everything else involved in the care for that patient, whether it's a role or an internal or external factor, it all revolves around the patient. All parts of the solar system have to work together in order to circulate and complete the task at hand. Every aspect of the solar system works together in unison, or so I'd hope, to avoid catastrophe and peaceful living. For all patients, we want everything to work in harmony, although sometimes we can have issues that arise, being my lovely asteroid. In Peplau's theory, her primary focus with nursing is how persons relate to one another. With the patient and all other factors, if working in unison, the end goal can definitely be reached. Evolution, two other nursing theories that I chose that are newer is synergy model for patient care and future nursing core competencies. The synergy model for patient care has the patient viewed as a biological, social, and spiritual entity who presents at a particular developmental stage in their life, each which required different levels of attention. This can relate back to Peplau's theory with the nurse and patient relationship. The environment is yet again created by the nurse to care for the patient, and this can again be based off of the relationship that is established between the two. The optimal level of wellness as defined by the patient is another primary goal of nursing, and the nurse should not only work to meet the needs of the patient, but also the family to provide safe passages during this crisis. In the newer nursing theory of future nursing core competencies, it is not only the patient, but also the family, group, or community that is involved with this patient. The environment focuses down to the atmosphere and milieu that the patient lives, works, and breathes. Health can be defined as an experience, whether it be wellness or illness, and probably my favorite nursing meta-paradigm concept so far, quotes to the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the caring of individuals, families, groups, communities, and populations. You can again tie this back to Peplau being the overall therapeutic interpersonal process between the nurse and the patient. You look at every aspect and do what needs to be done. Every nursing theory, it all boils down to the art and science of nursing. It is based on a framework of caring and respect for all humans and their dignity, and we must provide a compassionate approach to patient care in a safe and competent manner.